Question 1. A prescription calls for metoprolol tartrate 25 mg bid for 30 days. How many tablets should be dispensed if the available strength is 25 mg per tablet? I. 30 tablets. B. 60 tablets. C. 90 tablets. D. 120 tablets. Answer B. 60 tablets. This question tests your ability to calculate the total quantity of medication needed for a prescription based on the dosing instructions and duration. The key is to recognize that BID means twice a day. So for 30 days, the patient will take 2 tablets per day, 1 tablet in the morning and 1 tablet in the evening. Therefore, 2 tablets/day multiplied by 30 days equals a total of 60 tablets. Always break down the prescription into daily doses first, then multiply by the number of days to avoid errors. Question 2. Which of the following drug classifications is typically used to treat hypertension? I. Antihistamine. B. Antidepressant. C. Beta blocker. D. Antibiotic. Answer C. Beta blocker. This question assesses your knowledge of common drug classifications and their therapeutic uses. Hypertension is the medical term for high blood pressure, and beta blockers are a class of medications specifically designed to lower blood pressure by blocking the effects of adrenaline. Other options like antihistamines treat allergies, antidepressants treat mood disorders, and antibiotics treat bacterial infections, none of which are primarily used for high blood pressure. Understanding the main purpose of each drug class is fundamental for a pharmacy technician. Question 3. What does the abbreviation NPO commonly mean in a hospital setting? I. As needed. B. Nothing by mouth. C. Nightly at bedtime. D. By mouth. Answer B. Nothing by mouth. This question tests your understanding of common medical abbreviations, which is crucial for patient safety and pharmacy practice. NPO is a Latin abbreviation for nil per os, meaning nothing by mouth. This instruction is often given to patients before surgery or certain medical procedures to prevent aspiration. Recognizing this abbreviation correctly prevents serious medication errors. Always clarify any unfamiliar abbreviations with a pharmacist or nurse to ensure patient safety. Question 4. A pharmacy technician receives a prescription for amoxicillin suspension 250 mg per 5 milliliters, with instructions to dispense 150 milliliters. The patient needs to take 500 milligrams 3 times a day. What is the day supply for this prescription? I. 5 days. B. 5 days. C. 10 days. D. 15 days. Answer I. 5 days. This question requires you to calculate the day supply for a liquid medication, integrating concentration and dosage. First, determine how many ml are needed per dose. 500 milligrams is requested, and the strength is 250 milligrams per 5 milliliters, so 10 milliliters are needed per dose. 500 mg/250 milligrams per 5 milliliters equals 10 milliliters. The patient takes this 3 times a day, so 30 milliliters are used daily. With 150 milliliters dispensed, the total day supply is 150 milliliters/30 milliliters per day, which equals 5 days. Breaking down dosage calculations step by step helps prevent errors. Question 5. Which of the following drugs is a common over-the-counter, pain reliever, and fever reducer that is not an NSAID? I. Ibuprofen. B. Naproxen. C. Acetaminophen. D. Aspirin. Answer C. Acetaminophen. This question focuses on identifying common pain relievers and understanding their pharmacological classifications. Acetaminophen, Tylenol, is a widely used analgesic, pain reliever, and antipyretic, fever reducer that works differently from nonsteroidal anti-inflammatory drugs, NSAIDs. Ibuprofen, naproxen, and aspirin are all NSAIDs, which reduce pain, inflammation, and fever by inhibiting prostaglandin synthesis. Remembering that acetaminophen is distinct from NSAIDs is important, especially for patients who cannot take NSAIDs due to conditions like stomach ulcers or kidney problems. Question 6. According to federal law, how often must a controlled substance inventory be conducted? I. Annually. B. Biennially, every 2 years. C. Every 3 years. D. As needed. Answer B. Biennially, every 2 years. This question tests your knowledge of federal regulations regarding controlled substances, a critical area for pharmacy technicians. Federal law mandates that pharmacies conduct an inventory of all controlled substances at least every 2 years, also known as biennially. This inventory must be accurate and on file to ensure accountability and prevent diversion. Always keep precise records for controlled substances. It's a key part of maintaining compliance. Question 7. A prescription states, take 1 tablet POQS. What does QHS mean? I. Every hour. B. Every morning. C. At bedtime. D. Every 4 hours. Answer C. At bedtime. This question evaluates your proficiency with common prescription abbreviations, which are essential for accurately interpreting drug orders. QHS is an abbreviation derived from the Latin quaque ora somni, which translates to every night at bedtime. Knowing this ensures the patient takes their medication at the correct time, which can be crucial for drugs that cause drowsiness or are best taken away from food. Always be vigilant with abbreviations to prevent dosing errors. Question 8. What is the primary purpose of a black box warning on a medication label? I. To indicate the drug is safe for pregnant women. B. To highlight severe or life-threatening risks associated with the drug. C. To suggest alternative, less potent medications. D. To show the drug is available without a prescription. Answer B. To highlight severe or life-threatening risks associated with the drug. This question tests your understanding of critical patient safety information on drug labels, specifically the significance of a black box warning. A black box warning, also known as a boxed warning, is the strongest warning that the FDA requires for medications that carry significant risks, such as serious side effects or potential for misuse. It's designed to draw attention to these dangers to ensure healthcare providers and patients are fully aware. Always take these warnings seriously. They're there to protect patients from severe harm. Question 9. Which of the following medications is a common generic drug for the brand name Lipitor? I. Simvastatin. B. Atorvastatin. C. Rosuvastatin. D. Pravastatin. Answer B. Atorvastatin. This question assesses your familiarity with common brand and generic drug names, particularly within the top 200 drugs. Lipitor is a well-known brand name for atorvastatin, which belongs to the statin class of drugs used to lower cholesterol. While simvastatin, rosuvastatin, and pravastatin are also statins, they are different generic drugs with their own brand names. Connecting brand and generic names accurately is vital for dispensing the correct medication and avoiding errors. Question 10. A pharmacy receives a recalled medication. What is the technician's immediate responsibility regarding this product? I. Continue dispensing it until new stock arrives. B. Return it to the shelf and label it for recall. C. Immediately quarantine the product from other inventory. D. Offer it to patients at a discounted price. Answer C. Immediately quarantine the product from other inventory. This question focuses on quality assurance and patient safety procedures, specifically how to handle recalled medications. When a recall is announced, the technician's immediate responsibility is to physically separate the recalled product from all other usable inventory to prevent it from accidentally being dispensed. This ensures patient safety and compliance with recall procedures. Never dispense a recalled product. Always follow the established recall protocol to protect patients. Question 11. How many milliliters are in 2 liters? I. 20 milliliters. B. 200 milliliters. C. 2,000 milliliters. D. 0.002 ml. Answer C. 2,000 milliliters. This question tests your basic understanding of metric system conversions, a fundamental skill in pharmacy math. There are 1,000 milliliters in 1 liter. Therefore, to convert 2 liters to milliliters, you multiply 2 by 1,000, resulting in 2,000 ml. Mastering these simple conversions is essential for accurately measuring and preparing medications. Question 12. A patient asks the pharmacy technician about the best way to take their new antibiotic, doxycycline, and mentions they are also taking antacids. What is the most appropriate action for the technician? I. Advise the patient to take the antacids with the antibiotic. B. Recommend the patient take the antibiotic with milk. C. Advise the patient to avoid taking antacids at the same time as doxycycline. D. Tell the patient to stop taking antacids while on the antibiotic. Answer C. Advise the patient to avoid taking antacids at the same time as doxycycline. This question assesses your knowledge of common drug interactions and the appropriate scope of practice for a pharmacy technician. Doxycycline, like other tetracycline antibiotics, can have its absorption significantly reduced by antacids containing aluminum, magnesium, or calcium. While a technician cannot give clinical advice, recognizing this potential interaction means they should advise the patient to separate the doses by a few hours or refer the patient to the pharmacist for more detailed counseling. It's crucial to identify potential issues and know when to involve the pharmacist for patient safety. Question 13. Which schedule of controlled substances has the highest potential for abuse and no accepted medical use? I. Schedule 2. B. Schedule 3. C. Schedule 4. D. Schedule 1. Answer D. Schedule 1. This question delves into federal controlled substance scheduling, a key component of pharmacy law. Schedule 1 drugs, such as heroin and LSD, are defined by the Drug Enforcement Administration as having a high potential for abuse and no currently accepted medical use in treatment in the United States. Schedule 2 drugs also have a high potential for abuse but do have accepted medical uses. Understanding this distinction is fundamental for handling controlled substances legally and safely. Question 14. What is the primary role of a pharmacy technician in a sterile compounding environment? I. Prescribing sterile medications. B. Counseling patients on sterile product administration. C. Preparing sterile products under the supervision of a pharmacist. D. Performing final verification of compounded sterile products. Answer C. Preparing sterile products under the supervision of a pharmacist. This question focuses on the specific duties of a pharmacy technician within the specialized area of sterile compounding. The primary role of a technician in this setting is to prepare sterile products, such as intravenous for solutions, while strictly adhering to sterile technique and under the direct supervision of a licensed pharmacist. Prescribing, counseling, and final verification are responsibilities that fall under the pharmacist's license and expertise. Technicians are integral to the process but always function under pharmacist oversight. Question 15. A prescription requires 300 milligrams of a drug. You have 100 milligrams tablets available. How many tablets should be dispensed per dose? I. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Answer C. 3 tablets. This is a straightforward dosage calculation question, testing your ability to determine the number of tablets needed per dose. If the prescription calls for 300 milligrams and each tablet contains 100 milligrams, you simply divide the desired dose, 300 mg, by the strength per tablet, 100 mg/tablet. This calculation yields 3 tablets per dose. Accuracy in these calculations is paramount to ensure the patient receives the correct amount of medication. Question 16. What is the purpose of medication reconciliation? I. To ensure all patients receive generic medications. B. To compare a patient's current medication list with the medications ordered or administered. C. To discard expired medications from the pharmacy. D. To help patients pay for their medications. Answer B. To compare a patient's current medication list with the medications ordered or administered. This question pertains to quality assurance and patient safety, specifically the process of medication reconciliation. This critical process involves creating the most accurate list possible of all medications a patient is taking, including prescription, OTC, and herbal products, and comparing it against the physician's orders. The goal is to prevent medication errors, such as omissions, duplications, dosing errors, and drug interactions, particularly during transitions of care. It's a key safety measure to ensure continuity of care. Question 17. Which of the following is an example of an auxiliary label? I. The pharmacy's contact information. B. Take with food. C. The drug's NDC number. D. The patient's date of birth. Answer B. Take with food. This question assesses your understanding of auxiliary labels, which are additional warning or informational stickers placed on prescription vials. Auxiliary labels provide important instructions for proper medication use, storage, or potential side effects beyond what's on the main prescription label. Take with food is a classic example, as it gives crucial guidance for optimal absorption or to minimize stomach upset. These labels are vital for patient education and adherence. Question 18. A prescription for a cough syrup instructs, take 1 teaspoon POQ4-6H PRN cough. How many milliliters is 1 teaspoon? I. 1 milliliter. B. 5 ml. C. 5 milliliters. D. 10 milliliters. Answer C. 5 milliliters. This question tests your knowledge of common household measurement conversions relevant to pharmacy practice. 1 teaspoon, TSP, is universally recognized in pharmacy as equivalent to 5 milliliters. Well, this conversion is fundamental for accurately counseling patients on liquid medication dosages and for preparing prescriptions. Always remember 1 teaspoon equals 5 milliliters and 1 tablespoon equals 15 milliliters to ensure patient understanding and correct dosing. Question 19. What is the generic name for Singular, a common medication for asthma and allergies? I. Albuterol. B. Montelukast. C. Fluticasone. D. Cetirizine. Answer B. Montelukast. This question tests your recall of brand and generic names for frequently prescribed medications, especially within the respiratory category. Singular is the brand name for Montelukast, leukotriene receptor antagonist used to prevent asthma attacks and treat seasonal allergies. Albuterol is a bronchodilator, fluticasone is a corticosteroid, and cetirizine is an antihistamine, all of which are distinct medications. Linking brand and generic names correctly is crucial for safe and accurate dispensing. Question 20. Which federal act mandated that all drug products must be proven effective before marketing? I. Pure Food and Drug Act of 1906. B. Federal Food, Drug, and Cosmetic Act of 1938. C. Kefauver-Harris Amendment of 1962. D. Controlled Substances Act of 1970. Answer C. Kefauver-Harris Amendment of 1962. This question explores key federal pharmacy legislation, a vital area of pharmacy law. The Kefauver-Harris Amendment of 1962 was a pivotal legislative response to the thalidomide tragedy, requiring that all new drugs not only be safe but also effective before they could be marketed. Prior to this, drugs only needed to demonstrate safety. Understanding these historical acts helps you appreciate the rigorous standards that govern drug approval today. Question 21. A prescription reads, Synthroid 0, 1 mg daily. What is the equivalent dose in micrograms, mg? I. 0.0001 mg. B. 1 microgram. C. 10 micrograms. D. 100 micrograms. Answer D. 100 micrograms. This question tests your ability to perform metric conversions, specifically between milligrams, mg, and micrograms, mg. There are 1,000 micrograms, mg, in 1 milligram, mg. To convert 0, 1 mg to micrograms, you multiply 0, 1 by 1,000, which equals 100 micrograms. Accurate conversions are essential, especially with potent medications like Synthroid, levothyroxine, where even small errors can have significant patient impact. Question 22. Which of the following is a common side effect of opioid pain medications? I. Diarrhea. B. Insomnia. C. Constipation. D. Increased heart rate. Answer C. Constipation. This question assesses your knowledge of common drug side effects, which is important for patient counseling and recognizing potential adverse events. Constipation is a very common and often problematic side effect of opioid pain medications, resulting from their action on the gastrointestinal system, which slows bowel movements. Other common side effects include drowsiness and nausea. Being aware of these helps technicians anticipate patient needs and refer them to the pharmacist for counseling on managing side effects. Question 23. What does the term formulary refer to in a pharmacy setting? I. A list of patients who have filled prescriptions at the pharmacy. B. A list of preferred medications approved for use by a health plan or institution. C. A document detailing the pharmacy's daily sales. D. A set of guidelines for sterile compounding procedures. Answer B. A list of preferred medications approved for use by a health plan or institution. This question tests your understanding of common pharmacy management terms. A formulary is a continually updated list of prescription medications, both generic and brand name, that are approved for use and covered by a health insurance plan or within a hospital system. Drugs on the formulary are usually preferred due to their clinical effectiveness and cost-effectiveness. Understanding formularies helps technicians process prescriptions and explain coverage issues to patients. Question 24. Which of these medications is commonly used to treat type 2 diabetes? I. Lisinopril. B. Metformin. C. Furosemide. D. Atorvastatin. Answer B. Metformin. This question requires you to identify a common medication for a specific disease state. Metformin is a first-line medication widely prescribed to manage type 2 diabetes by lowering blood glucose levels. Lisinopril is for hypertension, furosemide is a diuretic, water pill, and atorvastatin is for high cholesterol. Knowing the primary use of common drugs is fundamental for a pharmacy technician. Question 25. What is the beyond use date, BUD, for a non-aqueous compounded preparation if the active ingredient is a USP or NF substance? I. 6 months or the earliest expiration date of any ingredient, whichever is shorter. B. 1 year or the earliest expiration date of any ingredient, whichever is shorter. C. 14 days when stored at controlled cold temperatures. D. 30 days at room temperature. Answer I. 6 months or the earliest expiration date of any ingredient, whichever is shorter. This question tests your knowledge of United States Pharmacopoeia, USP, guidelines for determining beyond use dates, BUDs, for compounded preparations, which is crucial for patient safety and medication stability. For non-aqueous, meaning not containing water, compounded preparations, the BUD is generally no later than 6 months, or the earliest expiration date of any active pharmaceutical ingredient, whichever comes first. This guideline ensures that the medication remains potent and safe for the patient during its intended period of use. Question 26. A patient presents a prescription for azithromycin 500 mg x 1 day, then 250 mg x 4 days. How many 250 mg tablets should be dispensed in total? I. 4 tablets. B. 5 tablets. C. 6 tablets. D. 7 tablets. Answer C. 6 tablets. This question tests your ability to calculate the total quantity for a tapering or multi-day dose prescription. On day 1, the patient takes 500 milligrams, which is equivalent to 250 milligrams tablets. For the next 4 days, the patient takes 250 milligrams each day, which is 250 milligrams tablet per day, totaling 250 milligrams tablets. Adding these together, 2 tablets plus 4 tablets, the total number of 250 milligrams tablets to dispense is 6. Always break down complex dosing regimens day by day. Question 27. Which of the following acronyms is used to describe the process of continuous quality improvement in pharmacy practice? I. OSHA. B. PPO. C. CQI. D. HIPAA. Answer C. CQI. This question focuses on quality assurance terminology within pharmacy operations. CQI stands for Continuous Quality Improvement, which is an ongoing process of identifying, evaluating, and improving processes and outcomes to enhance patient care and safety. OSHA relates to workplace safety, PPO is a type of insurance plan, and HIPAA concerns patient privacy. Understanding CQI highlights the pharmacy's commitment to constantly refining its practices. Question 28. What is the maximum number of refills allowed on a Schedule III controlled substance prescription? I. No refills allowed. B. 1 refill. C. 5 refills within 6 months. D. 11 refills within 1 year. Answer C. 5 refills within 6 months. This question tests your understanding of federal regulations governing refills for controlled substances. For Schedule III and for controlled substances, federal law permits up to 5 refills within 6 months from the date the prescription was issued. Schedule II drugs, in contrast, cannot be refilled. Adhering to these refill limits is critical for compliance and preventing drug diversion. Question 29. A patient is prescribed a 10-day course of an antibiotic. The instructions are to take 1 tablet twice a day. How many tablets should be dispensed? I. 10 tablets. B. 20 tablets. C. 30 tablets. D. 40 tablets. Answer B. 20 tablets. This question is a straightforward calculation of the total quantity of medication needed for a specific duration. The patient takes 1 tablet twice a day, meaning they take 2 tablets each day. For a 10-day course, you multiply the daily dose 2 tablets/day by the number of days, 10 days, resulting in 20 tablets. Always double-check your calculations to ensure the patient receives the correct amount for their full course of treatment. Question 30. Which of the following conditions is celecoxib, Celebrex, typically prescribed for? I. High blood pressure. B. Depression. C. Inflammation and pain, e.g., arthritis. D. Bacterial infections. Answer C. Inflammation and pain, e.g., arthritis. This question assesses your knowledge of common drug uses and therapeutic categories. Celecoxib, Celebrex, is a COX-2 inhibitor, a type of nonsteroidal anti-inflammatory drug, NSAID, specifically prescribed to reduce inflammation and relieve pain, commonly associated with conditions like arthritis. It is not used for high blood pressure, depression, or bacterial infections. Linking a drug to its primary therapeutic use is a fundamental skill for pharmacy technicians.